Hey, hey. Hey, hey, hey.
Dr. Fasawe, please. Dr. Fasawe. Thank you, ma. Can I also have Dr. Ajayi Theophilus? Dr. Ajayi, please come over. So that we just roll it out. You're welcome.
Well, if you need 2 minutes.
2 minutes.
Yes, so just fine, like with panel technical aspect. You also have a presentation by Dr. Fashion.
Yeah,
Okay, so I want to know who's going on first. Is it her?
Because she's online.
Okay, so.
Is communication okay now?
Well, just one last bit so she can hear us. They're bringing over a cable now to sort that out. So within 2 minutes, we're good to go.
So what do you suggest?
Just if you hold for 2 minutes, that's it. Just hold for 2 minutes, and that's it. So she'll go on first, and then after she goes on, your presentation will come on the screen. The clicker is not confirmation because we didn't know you had a presentation, but I'm over here and I'll just slide. Yeah, that's fine. You better speak. Okay, thank you so much. So just to read.
I'd love to sit here, so it's
I was actually going to say, like,
because we can't see
that way you're in the middle. You can speak to the There you go. Dan, please help me speak to Objects to bring that cable real quick. That's what we're waiting for. She just finished about. Just like this, she can.
Thank you, sir. Good afternoon once again. Yeah. Correct. UNESCO Institute. Was that on? Really? How do you come about that? Hello.
Okay, testing. Okay, you should be able to hear us loud and clear on Zoom now. Can you hear us loud and clear?
I don't know if I'm supposed to hear anyone else.
Can you just speak for us so we can check if we can hear you?
Testing.
Yeah, we can hear you. Thank you. Okay, so can you just speak up again for us?
Testing.
Okay, yeah, that's fine. Let me just take this down a little bit. How about now? Can you still hear us?
I can still hear you, yes.
Okay, we probably need you to be a bit louder for us, please.
Okay, hold on a second. Let me put these. Is that a bit better?
Yes, it is. Thank you. Guys, what are we doing? We need to stop connecting now. I need to go. What are you plugging into? This is auxiliary 3. Okay, thank you.
Let me start by saying good afternoon to you, ladies and gentlemen, and in particular, let me welcome the Honorable Commissioner for Health. This is your domain. The title of this session is Improving Health Indices Through Investment in Air Quality Management. Excuse me, please, over there. Thank you very much. If we talk of air quality, it is measured with specific system-specific equipment. But one thing is very significant in air quality. It is just a measure of how clean the air is or how polluted the air is. I would not like to bore you. you to rule first. Are you with us, please? Can you hear me? Please, can we hear you? Please go ahead with your presentation. And you have a maximum of 7 minutes, if you don't mind. Go ahead.
Okay. Thank you very much. I'm just going to share my screen. All protocol observed, as we say. Thank you very much for this invitation. I hope you can hear me okay. I'm going to be speaking about, it's a real honor to have this great to see the session on this at the summit on integrated approaches, because this is really what I focus on. I'm going to spend most of my talk on
Thank you. We have just 30 seconds left.
Okay, thank you. The first is the feeders to engage young people with scientists, and the second of them is a largely unmet need for healthy public spaces. And so this is what we're doing with that. We're running experiments integrating air quality-built environments and health. This campaign is actually happening at the moment in Capetown, Lagos, and Accra, where we're taking an evidence-informed approach to monitoring clean air. So we recruited, this happens in Capetown and it's in Lagos now, coming up, rather it's in Accra now. We recruited 8 young citizen scientists from 18 to 35. We ran 2-day workshops informing them about the ways that air pollution impacts their health, understanding what motivates them. We then equipped them, they then designed their own running routes, so we had all these running routes.
Thank you very much.
They ran through the city. Can I just show you, I'll just show you the last phase.
And let that be the last thing, please.
Definitely. And this is what we do. So the idea for this is that we integrate those data on the air quality, and so they run with these air quality sensors, like that one there, in the t-shirt, and we can use the information they capture to actually design advocacy.
Thank you very much. That is happening in Lagos. Thank you very much. Thank you, thank you, thank you. I appreciate your presentation, especially telling us that the second largest cause of death in Africa, which I call premature mortality, is air pollution. And I know, and I'm happy that you did say that it requires multi-sectoral response. Dr. Fasawe, what is your response on this? Now your presentation. 7 minutes.
Good afternoon, everyone, especially the Honorable Commissioner for Health and the MD, IHS, whom I dragged into here as a potential partner in investing in air quality monitoring in Lagos State. She has pretty much said almost everything I wanted to say, so I'll just react to what I picked out from her conversation. But please go through my slides as I speak. Now, connecting air quality with health data is something we stumbled upon accidentally last year. Dr. Ajayi from the Ministry of Health represented the commissioner at a fora of pulmonologists who gave us data showing that at a certain time in Ikorodu, local government area of Lagos State, there was a sudden increase in bronchitis, asthma, allergy, and there I was talking about air quality. And at exactly the same time, we were running a project with the World Bank, who had given us 8 air quality monitoring machines. And one of these machines was in Ikorodu, Odogunyo. And at this particular period, it was flashing red lights, evacuate, evacuate, evacuate. And I'm thinking to myself, evacuate to where? How? Who? And we went there to see. And it was amazing to see that a steel smelting factory was recycling, smelting, without going through the due process. Their furnaces were faulty. Everywhere was covered in soot. Even on your skin, you could see it. And the most interesting thing is, at the same exact time, these pulmonologists were recording a case of increased pneumonia, bronchitis, and all. So at that point in time, I'm a medical doctor, but I'm also the general manager of the Environmental Protection Agency. I decided that focusing on the health impact of air quality is the way to go. Let's move back a little to HIV/AIDS. When HIV/AIDS came on board, it was a stigmatized situation. But we started talking about it and started using scare tactics. We started talking about cancer, putting on cigarette packs. Cigarettes cause cancer. I think in air quality management, it's about time we start letting people know the direct correlation between your quality of life, your health, and the air quality. Air pollution affects people throughout our lifetime, from before we are born, as children, as adults, and in the elderly. The doctor spoke about all of that, so I'm just going to scroll through and talk as an environmentalist. Okay, in managing air quality, really, we cannot leave it all to government and air quality monitoring machines. Right now in Lagos State, World Bank came with 7, left 1 behind, and there's 1 in the consulate, American embassy or American consulate, whom we're referencing it with. The other one is in my office in Lagos State, LASEPA. It doesn't do much for us. It doesn't cover the required area we need to cover. What do we then advocate? We're starting to tell everybody in this room and everybody out there that you can take charge of the air quality. What messes up the air? It's what we put into the air. Most of the time is anthropogenic activities. We heard in the major room about how transportation is the highest. We did a study, and in doing source apportionment, transportation got the highest percentage. And why is this? Cars are not made to pollute the air. It's because we're not servicing our cars as at when due. It's because our fuel is not completely combusting. It's because some substances that should not be in fuel is still being allowed into this country. Those are things we need to start looking at. In the Paris Convention, about 37 countries signed into something called nationally determined contributions. What will we do as a nation to reduce greenhouse gases, fight global warming, and fight climate change? I am putting it to us that we should start thinking of state-determined contributions and self-determined contributions. And from our homes, cooking with fire with wood is a major pollutant of the air. Emitting greenhouse gases, the NOxes, the SOxes, carbon dioxide. I don't want to go into the science of it, but air, oxygen is clean, is transparent, is odorless, and you can see through. Anything that affects any of these things is polluting the air and damaging our health, albeit on the long term. We are starting to see people come down with lung cancer, people who have never smoked in their lives, but they have been exposed to asbestos, exposed to inhaling particulate matter 2.5 and above for like 20 years. Of course, it will come back to haunt you. So my message really is what we are doing in LASEPA. We're restructuring the agency to go more into advocacy, go more into teaching people, go more into telling people. We have a Lagos Clean Air Initiative, and Lagos State, I am very happy that the governor right now, in his 6-pillar agenda, puts health and environment together, because he knows that your health is directly proportional to the quality of your environment. We have a climate action plan. In that nationally determined contributions, I can tell you that Lagos State is determining about 80 of it. And if all of us in here start to read about air quality and start to manage air quality, that 80 will move to 90. And honestly, it's just very simple. We see smoky cars on the road, and the police just ignore it. Road safety ignores it. LASMA ignores it. We need to start to make policies, which is what our climate action plan is all about air pollution. Heavy duty machinery, heavy duty machinery, heavy duty manufacturers. We're talking to manufacturers, we're talking textile industries, and we're encouraging recycling and reusing and proper disposal of waste. When we don't manage waste properly, it leads to air pollution. And our major strategy for the future is government cannot do it alone. We are currently partnering with the United States of America, who have supported us with a professor to give us technical support in the space of monitoring air quality. We are talking to multinationals and internationals, telcos, manufacturers, bottling companies, to join us in teaching, informing, educating, and communicating with the public as we have done here today. Thank you.
Thank you very much. You know one interesting thing? Dr. Fasawe will not like me. Dr. Fasawe is the environmental police person in Lagos State. I'm the police person in this particular session. You said something that really catches my fancy, which is the fact that take care of air quality. And she did say that our quality of life, our health, and air quality are three elements, like three fingers infected by whitlow, that we must take care of. Therefore, Dr. Ajayi Theophilus, do you agree with this?
Thank you very much. My Honorary Commissioner for Health, and all protocol duly observed. Well, Dr. Dolapo has told in the show, but at the same time, I have a lot of things to say too. Well, we are all seated here. But the first thing I want to say is that those out there, are they aware of air quality? Have we created enough awareness? If we don't do this, we are wasting our time. And those of us seated here, we also add that poor air quality affects our health. It causes cardiovascular disorder, respiratory disorder. But looking at the states, I don't want to go to what we do naturally, what we're doing, but I'll get into it later very soon. How do we work together to ensure air quality? It is very essential that air quality management has come to stay, and we have to improve on it. But we need to do the following things. One, in Lagos State, most agencies work in silos. We need inter-agency collaboration. Once we do this, my GM was talking about vehicular emission all around the city, and the police are not doing anything. Actually, it is the function of the inter-agency activity. If we collaborate together, we can form a team to ensure these things are actually stopped. So what are we talking about? We need to go into the environment, correct whatever is causing this, reduce emission, etc. And apart from that, in our monitoring activities, we need to become harmonized. Harmonization will assist us to cascade down to every sectors and every streams of the economy, what we are doing. The common people out there will now be able to understand what is air quality, how do we control air quality, what is it to the life. People, if you tell people that if you put Papau there, vehicular emission will kill them, they'll say it's a lie. So those are the things I think we need to look into. I actually agree with her. Thank you so much.
Oh, fantastic. Thank you very much. Thank you very much. Before we go into question and answer session, permit me to just drop this. Occasionally, when we move in Lagos, outside Lagos, elsewhere, we suffer some irritation, maybe in our eyes, in our nose, occasionally in our throat. What you see, what causes that is called particulate matters, which are small, small things in the environment. Some of them are fine, some of them are coarse, because they are measured in terms of size, if you like. When it is 2.5, when the PM is 2.5, that is those small, small particles in the environment, we say they are fine particulates. And when they are big, when they are coarse, up to 10, we say they are coarse particulate matters. So in going to question and answer now, I think I would like to fire the first bullet at Dr. Fasawe. I was disturbed when we had the presentation in the morning from Oando. I hope that figure has been validated when it said that the air quality index, AQI, in Lagos is 127. Honorable Commissioner, sir, I was worried. Because anything above 100 in air quality is very, very bad. So my question is for the Commissioner of, sorry, not for the Commissioner of Health. I won't bother you, sir. For Dr. Fasawe. For Dr. Fasawe. Could this be true? We have 127 AQI in Lagos State, and when the threshold should be 100, anything above 100 calls for great concern. Your response, ma'am.
Thank you very much. Mr. Awogbade is in here, and I had said to him as we were coming in, as an environmental lawyer, he should be suing the country and suing the state for poor air quality. This study was carried out by World Bank in 2020, and it was validated. For it to be published, it must have been validated. And I want to quickly tell you what that resulted into. It resulted into, I'll tell you exactly how many people died because of that, and how many children, how many adults, and in what proportion. We had about 11,700 premature deaths because of that air quality index. Economic loss was $2.1 billion. Economic loss meaning that downtime, people not coming to work, breadwinner dying from lung cancer and all. And we had 11,200 premature deaths, the highest in West Africa for that year due to air pollution. And out of this 11,200, the most painful part of it is that children under 5 accounted for 50% of the total number of deaths due to poor air quality. And I believe this is what made this current dispensation pay more attention to the to environment and climate. We have a climate action plan, which is intersectoral, Dr. Ajayi, multi-sectoral, and it has every sector of the government contributing and having a role to play. Thank you.
Thank you very much. I'm very happy that Lagos State government is taking this with all level of seriousness. Very well done. The floor is now open for questions, comments. And I will appreciate if you can be smart, succinct, and clear about your question. Therefore, please raise your hands. I'll be very sensitive regarding gender. I will call a lady first. If I see a lady, I'm first because I come from a lady or a woman. So, ladies, raise your hands. You are the first to go. I can see a masculine hand up. I have not seen a feminine one. Are there no ladies in the house? Otherwise, I will call somebody now. Titi, your question. Yes, can somebody have the mic? Comment. Yes, comments, if there is no question from you. Because I know you are the vanguard of environmental sustainability.
I'll think of a question.
Think of it.
Okay, thank you very much. I am so happy that we all have the data.
Good.
And if we have children dying, and the only thing I didn't hear is how many women are dying as a result of this, and how many are pregnant. These are very important things for us to know, so that we will know what to do at the level of the Ministry of Health. And I think we should do a deeper research into this. Look at our own public health records in Lagos State. How do we connect it to the air quality in Lagos and be specific about what we have for Lagos State? Because whatever we have is all around the world, and I'm not so sure that we have been able to do that kind of important linkage that we really need to do. And I think the Ministry of Health needs to do better on that.
Thank you very much. Yes, because you sit beside her, let me give a chance to people behind her. Yes, the gentleman in yellow and in glasses. Let's be succinct, let's be brief.
Thank you very much. My name is Olumide.
Yes, sir.
My first question goes to the doctor. You've been talking about climate action, and where Nigeria is going to now, we have a lot of policies that is not actually implemented. I don't know how we are trying to look at the component of air quality in that climate change plan to actually, replicate the solutions you have been talking about. And the last one is, how do you manage political will when it comes to implementation? Thank you.
Thank you very much. Please note all the questions. Yes. Okay. Please go ahead, sir. Maybe I take 2 questions more because Professor Alo is already signaling that we need to close this shop.
It's more of a comment.
Go ahead.
I didn't have a conclusion about it. I think we'll do better by not just looking at this air pollution, where they are, but more importantly, what can we do? And that brings me to the issue of tree planting. You see, most uses of trees people don't know is air quality control. You see, the bark of trees absorb noxious gases. So we need to do some studies in trying to factor equity in our tree planting campaign. Thank you.
Thank you very much. Yes, the lady there and the gentleman with red cap. The lady first, please. I come from a woman.
My name is Mercy from International Center for Environmental Health and Development. We're talking about air quality. I just looking back to what happened, is that happened last year, ending of last year. A friend of mine happened to live in a rugged area. The place is actually too rugged, but the situation there is that there are some guys there that smoke. They don't just smoke cigarettes. They smoke what we call the book. So, but this is what I'm driving at. Now, the smoking is not the problem initially. But it's issue that you have buildings that are built so close to each other, and what moves from one building enters through the window of another building. That you end up hanging clothes in your room, and your clothes start smelling the room. So now, this is what it sounds so crazy until I saw it and I perceived, if I could believe it. It was hard to believe. So why am I saying this? Please, I want to know, these things they smoke, are we saying it does not affect the air quality? That is number one. Secondly, what are we doing about it? Thank you.
And if the Igbo affects your cloth, you are afraid whether it will affect your body. The last person, please. Then our...
Thank you, sir.
Yes, sir.
My name is Dolapo Fasawe. I know climate action is multi-sectoral. And looking at the Lagos perspective, LASEPA is for Lagos State. What we do for the national level extra, and in conjunction with private sector, that's our government sectoral perspective. Then looking at our PPP, public-private partnership, in terms of enforcement of standard of laws, who you see at form of an enforcement, you only look at air quality, look at atmosphere, look at carbon dioxide, nitrogen oxide, nitrogen oxide, being polluted. How could you see it in that perspective?
Thank you very much. I think we can now allow our teachers, our lecturers, of our facilitators, for lack of more better words, to respond. And may I know whether Dr. Oni, are you still online, ma? If not, let me have Dr. Fasawe. Please, bear with me, I come from a woman.
Thank you very much. I'll just be quick. First to Titi. In everything, I think the woman is the underdog, because the woman who is cooking with firewood and has a baby on her back is exposed to poor air quality. The baby itself is exposed to a poor air quality. poor air quality has been known to cause premature births, premature labor. It has also been known to cause death at delivery. So yes, it's something gender activists need to look at and talk more about. And to Olumide, the Climate Action Plan, it's online. You can, there's a barcode, even the booklet is everywhere. And you as a private citizen, you as a CSO and NGO also has a role to play. It is a plan, but we are hoping it will become a policy and eventually a law. If it is institutionalized, there's no matter of political will. You like it or not, it has come to stay. And that is what we're working towards in Lagos State. And as per indoor air pollution, the Igbo smelling, in some states, in some countries, is illicit substances. So, in some countries, it is legal because there's diffusion. It may not harm you if you're walking by really. What you put into the particular matter is it's complex. But indoors, indoor air pollution is something we are not looking about, but we should be talking about it. If it smells on your cloth, to the best of my knowledge, it affects your cognition and your neurological function. I can't talk about the law that will say I will have to arrest the person next door. Maybe Commissioner for Health will talk about that. And about the obnoxious